If we're going to be truly honest here, patient services teams are fundamentally different than sales teams. But the tools that we give these teams, the CRM, the different systems that we give our patient services teams, they're not designed for these teams. They're just adapted from the sales team, the sales org. And this leads to a lot of frustration, this leads to a lot of inefficiencies, and ultimately many scripts that don't convert to paid therapy, which really hurts the bottom line. Let's get into some specifics. Number one, sales reps are focused on the prescriber. This is the MD, the DO, the NP, the PA, all of the people who can ultimately prescribe. The patient services teams are focused on the office staff, the MA, the biologic coordinator, the billing coordinator, the nurse. These are entirely different populations and stakeholders. Number two, the roles and responsibilities are so different. While sales reps are focused on the safety and efficacy of the drug in the clinical trial, the patient services teams are focused on all things related to the insurance company. They're focused on the benefit verification, the prior authorization, the reauthorization, the reimbursement rates, the appeals, the denials, the letter of medical necessities. These are just a totally different language and a totally different focus. Number three, these end users are so different. That means the software and the tools that they use need to be designed totally differently. The way the screens are arranged, the way that information and data is presented, it's totally different. The way that you're gonna automate the workflows to minimize the number of clicks, the way you're gonna leverage AI, it's so different. If you're in patient services, you really need to know not the information of the prescriber, but the office staff. And sometimes that staff is in a totally different office and location than the prescriber. And that's really important information. You need to have access to that.